We are going to talk about bones of the upper limb, starting with clavicle and scapula. The clavicle is a long bone. Commonly, it is also known as beauty bone. It supports the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmits the weight of the limb to the sternum. We can say that it connects the upper limb to the axial skeleton. Clavicle bone has a curved part called the shaft and two ends, lateral and medial. There are two clavicles in the upper limb. You can determine the side to which the bones belong to by keeping these features in mind. As you can see here, the lateral end is flat and the medial end is large and quadrilateral. The shaft is slightly curved so that it is convex forwards in its medial 2/3 and concave forwards in its lateral 1/3. We will get into details of that in a minute. So you can determine the side to which a clavicle bone belongs to by looking at it closely and keeping these points in mind. Now let's talk about the shaft of clavicle. The shaft is divisible into the lateral 1/3 and the medial 2/3. The lateral 1/3 of the shaft has two borders, anterior and posterior. The anterior border is concave forwards. The posterior border is convex backwards. This part of the bone has two surfaces, superior and inferior. The superior surface is subcutaneous, and the inferior surface presents an elevation called the conoid, tubercle, and a ridge called the trapezoid ridge. As for the medial 2/3 of the shaft is rounded and is said to have four surfaces. The interior surface is convex forwards. The posterior surface is smooth. The superior surface is rough in its medial part. The inferior surface has a rough oval impression at the medial end. Now that we have talked about the shaft, let's look at the lateral and medial ends. Just for a bit of revision, the lateral end, or the lateral aspects, is the one that is away from the midline of the body, while the medial end or aspect is the one that is towards the midline of the body. Lateral and medial ends. The lateral end is flattened from above downwards. It bears a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. That is why it is also called as the acromial end of the clavicle. The medial end is quadrangular and articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. Hence it is also known as the sternal end of the clavicle. The articular surface extends to the inferior aspect for articulation with the first costal cartilage. The main function of the bones is to provide structure to the body. That is not possible without the presence of muscles. Muscles attach to the bones. They either originate from a bone or insert in another. Since we are talking about the bones of upper limb, we will go through the attachment sites of different muscles on these bones. The muscular attachment of the clavicle can be described in terms of capsule attachment, muscle origin, and muscles insertion. Capsules. At the lateral end, capsule of acromioclavicular joint is attached as shown here. At the medial end, fibrous capsule of sternoclavicular joint is attached as shown here. Muscles. The muscular attachment is of two types, origin and insertion. The muscles that originate from the clavicle are sternocleidomastoid, pectoralis major, sternohyoid, and deltoid. Muscles that attach to the clavicle are trapezius and subclavius. That is all about the bony landmarks of the clavicle and the muscular attachments. Moving on, we will now talk about the bone known as scapula. The scapula, also called shoulder blade, is a thin flat bone placed on the posterolateral aspect of the thoracic cage. It is triangular. It connects the upper limb with the thoracic cage, also called scapula-thoracic articulation. Scapula also articulates with the humerus to form the glenohumeral joint and with clavicle to form the acromioclavicular joint, respectively. The scapula has 2 surfaces, 3 borders, 3 angles, and 3 processes. Let's look at them in more detail. Costal and dorsal surfaces. The costal surface, or subscapular fossa, is concave and is directed medially and forwards. It is marked by 3 longitudinal ridges. Another thick ridge adjoins the lateral border. This part of the bone is almost rod-like. It acts as a lever for the action of the serratus anterior in overhead abduction of the arm. The dorsal surface gives attachment to the spine of the scapula, which divides the surface into a smaller supraspinous fossa and a larger infraspinous fossa. Now let's talk about the 3 borders of this triangular bone. The 3 borders of the scapula are shown here. The superior border is shortest. Near the root of the coracoid process, it presents the suprascapular notch. The lateral border is thick. At the upper end, it presents the infraglenoid tubercle. The medial border is thin. It extends from the superior angle to the inferior angle. As for the 3 angles, the superior angle is covered by the trapezius. The inferior angle is covered by the latissimus dorsi. It moves forwards round the chest when the arm is abducted. And the lateral or glenoid angle is broad and bears the glenoid cavity or fossa, which is directed forwards, laterally, and slightly upwards. A supraglenoid tubercle is present above the glenoid cavity. 3 processes. But wait, what does it mean, processes? In anatomy, by processes it means the prominent projections of the on a bone. A process protrudes from a bone and serves as an attachment point for tendons and ligaments. The scapula also has many processes, including the acromion process and the coracoid process. These processes are sites of muscle attachment and ligament attachment that bind the scapula to the clavicle. The spine or spinous process is a triangular plate of bone with 3 borders and 2 surfaces. It divides the dorsal surface of the scapula into the supraspinous and infraspinous fossa. Its posterior border is called the crest of the spine. The crest has upper and lower lips. The acromion process has 2 borders, medial and lateral, 2 surfaces, superior and inferior, and a facet for the clavicle. The coracoid process is directed forwards and slightly laterally. It is bent and finger-like. As for the muscular attachments, as you can see, we have 2 capsules. Capsule of the shoulder joint, capsule of the acromioclavicular joint. As for the muscles, many muscles originate from the costal and dorsal surfaces of the scapula. The muscles that originate from the costal surfaces are subscapularis, deltoid, coracobrachialis, long head of triceps and biceps brachii, and omohyoid. On the other hand, the muscles that originate from dorsal surface are supraspinatus, infraspinatus, teres minor and major, latissimus dorsi, deltoid, and coracobrachialis. Muscles that insert at the costal surface of scapula are pectoralis minor, serratus anterior, and digitations. And lastly, the muscles that insert at the dorsal surface are levator scapulae, rhomboid minor and major, and trapezius. That is all about the scapular bones. It can be hard to retain everything at once. So for your quick review, here is the summary for what we have studied so far. The clavicle is a long bone that has its own distinct bony landmarks. The lateral end of the bone is flat, and the middle long part is known as shaft. The medial end is larger than the lateral end. We talked about the different muscles that either originate from or insert into the clavicle. As for the scapula, the bony landmarks of these bones are divided into 4 categories of surfaces, borders, angles, and processes. Several important muscles are attached to the scapula, especially those that play a role in the movement of upper extremity.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.